Hello, our viewers. This is Coherent TV, and we are live on the Big Topic Show with your host Emanuela. And today we are going to tackle in an interesting topic as well, and we're going to discuss about self-care when it comes into reproductive health services. And I have a distinguished guest with us here in the building, and she is going to introduce herself to us. And later on, we can delve deep into our topic of today. You're most welcome.
Thank you so much. My name is Dr. Carol. I'm the proprietor, Cure Healthcare. Cure Healthcare is located along Tula Road in Kawempe, just opposite former Avis. I'm happy to be here. I'm glad to be here.
Well, thank you so much, and you're welcome, Doctor, once again. And just like I said earlier on, we shall be discussing about self-care. And now, Doctor, from your experience, I would love to know from you, how do you define self-care when it comes into in the context of reproductive health, and especially when we talk about abortion care and family planning services?
Okay, thank you so much. Self-care is basically loving yourself. We are all aware the issue of having sex is normal and we expect it to occur, and that is how we reproduce, basically. So self-care is, like I said earlier, loving oneself and making informed decisions about when to handle the results of having sex. For example, having children. Especially having children, actually. In that line, I'll be looking at when you would like to have a child. So in that measure, we should be informed about family planning and also the services of post-abortion care. We all know, or we are all aware that children as young as 14 are having children, which I don't think is what they have decided to do. The older people will not be talking about them so much because they're adults and they're probably making informed decisions. But we focus on the children because they're young. I imagine that they need to be informed. They need to be informed about what they're doing. Most of us have our first children without even knowing what we are getting into. So in that regard, it's very important for us as healthcare workers to focus on educating the masses and also basically giving them an ear. When someone comes to your facility, please be open, be kind, be receptive, listen to them so that you can be able to advise them better. For a long time, a lot of health workers have basically been pushing a closed ear, especially towards abortion. So most people feel now that the government, it's illegal for abortions, but as healthcare workers, it is our role to save people who have to do post-abortion care. Yes, so but you cannot do it if you're pushing your friends away. So please be open as healthcare workers. Please be open, receptive, listen, and know how best to help. Thank you.
Well, talking about self-care, I just want to know from you, from your observations and from your interactions with the various clients that you get to interact with, do you think people really are so much aware of about self-care? Because you had earlier on say that it's all about loving yourself and all that. So do you think people really know about self-care?
Yes, some people are aware, but we still have a big number of people that are not aware. Well, they love themselves and all, but a lot of times we are torn between when to do what, especially as young people, because young people, we are not yet matured to make decisions. And that's why a lot of times we keep with our parents up to a certain age. But like you know, some families, especially like where I work here, you'll find a big family of about 8. They're staying in one room, separated by a curtain. The parents are doing their things. So you find these children as young as 12, 13, 14. They're already aware about of what adults do. and they'll definitely want to try it out. In the process of trying it out, with or without knowing, there'll definitely be conception of some sort, because as a young girl, as long as you have a period, you can conceive. So our part is to inform, because I don't think there's anyone who would want to have a child at 12, 13, or 14. Yes.
Well, it's so sad that we really have children who are also having children. So I think there's really a lot of work that needs to be done in our communities to ensure that we get to reduce the numbers of these children who are getting pregnant when they are still children as well. Now, moving forward, I really want to know, I believe you have a lot of encounters when it comes into misconceptions. So what are some of those common misconceptions maybe among the clients that you interact with when it comes into access to self-care, especially in the context of reproductive health?
The misconceptions, there are many. I'll just talk about some of them. Like family planning has been with us for a while now. It is a good thing that most women and men are aware now, but we still have a lot of things lingering in the community that are not right. For example, a lot of people in the community believe family planning brings cancer, which is not true. Please be informed. Come to the health facilities. Let us sit down with you and let you know what will and what will not happen. About the side effects, because our bodies are different and also the family planning methods are different, we may have different side effects depending on who we are talking about. So come let us know what you're feeling, especially after starting on the family planning. Let us inform you depending on who you are, your weight, your age, your blood pressure. We'll do all those things at the health facility. We may not do them in the community, but what I can do now is to inform you that these things are happening at the health centers. Please come and involve us in your lives. Thank you.
Well, I've heard something common, in the communities where women say that that when you need a family planning method, that they need to first check your blood type. And is there something like that, or is just a misconception? And if it's a misconception, then kindly help us to clear out the area so that our women or the young girls get to know how to go about when it comes to accessing the family planning methods.
I'll take that as a misconception. The truth is, when you come to us, or let me just say, there is no blood test that anyone is going to do to know if you're part compatible. But there is a will. This is a medical eligibility will. It helps us to assess every lady differently. This will, we assess a lot of things. For example, your weight, your blood pressure. We look at if you have any chronic diseases, which could be maybe heart, kidney, or anything like that. And then we see which method you can use depending on you as an individual or what is going on. Yes. So yes, matches, we are not going to do any blood tests to find out which one matches you, but the healthcare worker, from the tests they are going to do and the assessment, they will know what family planning method will work for you.
Okay. Well, I think someone out there has at least gotten a clear picture of what happens. Now, I would love to know from you, how do you get to incorporate self-care into family planning counseling?
Every client that comes for family planning gets to sit down with the healthcare provider in a counseling session. And in that counseling session, as long as you follow the steps, especially like keeping closed doors, give privacy, talk to the person, introduce yourself, let them feel easy, comfortable, so they can open up to you. The more time you give this person, is the better information, the more information you're going to get, and the more you can help this person. Yes. So take more time during counseling, open up, or give this person time and space to be able to open up so that you can help them better.
Well, thank you. I also want to know from you, what are some of those challenges? I believe you could have encountered some of those clients who maybe reach out, experiencing challenges around our the use of family planning or even self-care when it comes into accessing either family planning or the abortion care services.
Part of the challenges, we have already talked about family planning at large, but we can talk about post-abortion care services. Um, and maybe I'll just pass this as a statement, is that all health facilities uh, have someone that will be able to help you uh, following an abortion. Or maybe I should also mention that abortion kills more women than giving birth. Yes, so abortion is also a serious health care, and we need to address it. These days, I think they're training even as low as the midwives, the nurses, to be able to do evacuations. So please reach out to the health facilities. They should be able to help you. Sometimes we encounter a challenge with our partners. A lot of men would like women to give birth. Most of them don't care because they're not the ones carrying the pregnancy. But as a lady, it is you who is going to carry the pregnancy. It is you who is going to get deformed. It is you who is going to have changes. It is you who is going to drop out of school. So we would love you, the young person, to decide when you really want to have this child. Of course, you bring another life into the world, and that life needs to be cared for. That life needs to go through the basics well. How are you going to be able to do that if you're not working, if you're not ready? Yes.
Okay, that's quite interesting. I now being a healthcare provider, I just want to know from you how best can you support the women and girls to ensure that they make informed and autonomous decisions in accessing reproductive health services, whether it being family planning or abortion care services.
The best way to do that is, one, informing them that we are here and are willing to help. Please come and talk to us. Two, we can join other organizations like Coherinate here and go out to the field, talk to these young people, those that may not be able to reach facilities. We are lucky here in Kampala. Facilities are everywhere, but there are places that are hard to reach where people don't have health services everywhere. The other thing is being receptive. Like I said earlier, a lot of health workers tend to push her way in. The moment someone hears, oh, abortion, it's like a taboo. Yes, it's not legal, but let's be more receptive. Give an ear. Listen to this child. What is going on? Maybe they've been raped. Maybe, I don't know. Give them some time. Listen to them, counsel them, and see how to help them.
Well, I think that is quite interesting because sometimes you get to find out that someone reaches out and before they get to let you know more details of what they really wanted and they're already being pushed out. So I think it's a good thing that you are calling out. I think it's a call to action to all the healthcare providers to be able to listen and be receptive when someone reaches out to accessing any reproductive health services. Well, we are coming to the closure of our program for today. I don't know if is there something else that you would really love our viewers to know?
Take care. Self-care is real. Let's love ourselves more than we're already doing. Make informed choices.
Well, thank you so much. I think I've loved something today that I need to love myself more than the way that I've been doing. Otherwise, this has been the Big Topic Show, and we were discussing about self-care. And please, if you've not been loving yourself, I think it's time that you really do it more than that you've been doing. And this is still the Big Topic Show. I'm your host, Emanuela. Keep watching Coherent TV. Kindly, if you have just tuned in, please follow us on all our social media handles because there's a lot of programs that we're having running on our on the TV, and you'll be able to get in more information. You can follow us on Twitter, Facebook, TikTok, everywhere. Otherwise, thank you so much for watching and keep tuned to Coherent TV.